There are a lot of therapies now that are approved for treatment of melanoma that take advantage of the immune system. They work for a lot of patients, but not everybody. So there's need for other therapies. Another approach, which is still experimental, but it's being used and has been shown to be effective in multiple centers, is adoptive T-cell therapy. This is where T cells, T lymphocytes, are transferred into a patient. So they're being adopted or adoptively transferred into the patient. They are your own T cells, they're your own lymphocytes. They've been taken out and engineered in a certain way and then put back into you. There are broadly two categories of those. One is just cells that are taken out of a tumor and then grown up outside the body with growth factors or other things that may just help them be activated and work well and expand, and then they're infused back in. Usually when that's done, there is some other treatment of the body that's done to sort of allow the immune system, this new adoptively transferred immune system, to take over the immune system that has been there before. So usually it involves chemotherapy to reduce some of the circulating lymphocytes, and then those are transferred back in. This approach is called TIL therapy, or tumor infiltrating lymphocyte therapy, TIL therapy. The other type of adoptive cell therapy is where the immune cells are taken out, typically from the blood, and rather than just being given a growth factor or some other stimulant, a genetic re-engineering is done, where a gene is inserted into those cells that enables that cell, that T lymphocyte, to recognize a target that it otherwise didn't recognize or didn't recognize well. For patients who have had melanoma and are at high risk for recurrence, there are some treatments that may be available that are approved by the FDA, but if you've either had those and failed them or aren't a good candidate for them, or for some reason have decided that's not for you, then there are experimental clinical trials available with cancer vaccines that you may be eligible for and are certainly worth considering. Those would be typically for melanoma that has spread to lymph nodes or to distant sites but has been taken out surgically. There also are situations where vaccines are being used either alone or in combination with other agents with advanced melanoma. There's promise for all of these approaches across many cancers, including melanoma, to continue to be developed, and I think we'll see a lot with that over the next few years.